Now, first of all, let's talk about the option of having a vaginal birth after a cesarean section, the pros and cons of this. Many women who have had one previous cesarean can still plan a vaginal birth. Overall, the success rate is around 7 out of 10 women. In your case, because your previous labor ended in a cesarean due to the baby not coming down, the chance of successful vaginal delivery may be slightly lower, but it is still possible, Amanda. Successful vaginal birth usually carries fewer risks and a quicker recovery compared to having a cesarean section. Faster recovery, return to the normal routine, less risk in future pregnancies compared to multiple cesareans, lower chance of breathing problems in the baby, earlier skin to skin contact, and higher chance of successful breastfeeding, Amanda. Am I clear so far? Having said that, there are some risks that I want you to be fully aware so you can make an informed decision. There is a slightly higher chance of needing an assisted delivery using a cup or a spoon. There is also an increased chance of needing an emergency cesarean during labor. The most important risk we discuss here is the scar giving way. This is uncommon but serious. The risk is about 1 in 200, Amanda. If this happens, it can cause heavy bleeding in mom. We may need an emergency cesarean section. Rarely, baby may not get enough oxygen inside the womb. That can lead to serious problems in the baby. Heavier bleeding than normal, may need a blood transfusion. Very rarely, if bleeding cannot be controlled, may need removal of the womb. This is extremely rare, but it can become life threatening, Amanda. I'm not saying this to scare you. My role is to be honest about the risks so that you can choose what feels right and safe for you and your baby.